Now, a year ago, Allie Powell had never heard of attention deficit disorder. But after reading about the symptoms last summer, well, actually it was her friend, certain things started to fall into place for her.
For as long as you could remember, Alison had been suffering from, well, various things. Mood swings, depression, anxiety, all common, we learn now, with ADHD sufferers. And last autumn, she was finally diagnosed with the condition after a long journey. Allie's here this morning, along with Dr. Marius Adamu as well. It was a bit of a long journey to get this diagnosed, and particularly surprising because most people associate this with youngsters who don't behave in class. Yes,
they do. I was in trouble quite a bit in class, but I wasn't it wasn't obvious. I was had a little desk on my own for talking, sent outside the door for talking. It wasn't obvious disruption. Yeah. I suppose my hyperactivity manifests itself in that way.
But no one really thought about looking for it in adults. It was always going to be something else wrong with you. You must have been depressed. It must have been your time of the month. There must have been something wrong with you.
It is strange that I suppose it's always been assumed that when a child with ADHD gets to the age of 18 that they stop having ADHD. But that isn't the case, and now it's newly recognised in the UK that ADHD is a condition that exists within adults.
But it wasn't a doctor that actually led you on this road, it was your best mate.
Yeah, that's true.
What did she say to you?
She'd come across a list of the symptoms, and I was just chatting one day and she said the symptoms made her think of me. So I said, what sort of symptoms? And she mentioned a few of the symptoms, which was enough to make me go onto the internet, and ADHDers are internet addicts as well, and researched. And the more I researched...
So when you were reading all this stuff, how did you feel then? Did things start kind of clicking into place?
I can't... It was totally overwhelming. I just couldn't believe. I would read a website and I was like reading about me and about my life.
Like what?
Oh, things, well, I've had numerous jobs throughout my life, so constant career changes. I'm totally very impulsive, very disorganised. But not just, I know you do get disorganised people, but I've always said to my parents, but my brain just doesn't think that way. I can't do it. My brain doesn't think, which is not a cop-out.
And did your parents, when you were younger, you said, you had so many, in trouble at school, left with very few qualifications, from job to job, nothing like, you couldn't settle at anything.
No.
Did any of your family ever say, this isn't right, something's not right here?
I was adopted as a baby, and I guess I am different to my family, so I guess that it was always attributed down to the fact that I was adopted. That's why I was different. Now we know that the differences are probably not because of that, but because I do have ADHD. But my parents have always been very supportive of me.
So once you read all this stuff on the internet and going, that's me, that's me, that's me, what did you do then?
Well, I went on forums actually, and that's the best advice that I've got from people. I suddenly, very quickly became aware that I would have problems getting diagnosed within the UK. And I was given an advice, somebody put on a forum that there is an adult ADHD expert in Swansea University. And somebody else said, what you need to do is think about how you approach your GP. Because you can't go in saying, oh, I got ADHD, organs blazing. They don't like that, do they? So the advice I was given was print out the professor's details, print out a list of symptoms and mark the ones relevant to you and approach it that way. And that's the way I approached it. And I did think about which GP I was going to go to as well, and I went to a GP who was very understanding.
So you did get the diagnosis, but why is it so difficult to get that diagnosis as an adult? Because, as Ali was saying, often you're told it's depression.
People think that ADHD stops at the age of 18.
Well, the treatment stops, doesn't it? If there any kind of medication happening at 18, it ends.
Well, this is quite a paradigm that doesn't apply very well. For example, in other countries, like the States, it doesn't. It continues through adulthood. And somehow the idea that the treatment expires at the age of 18 is something that people cannot accept. For example, if you have a child and they're having their treatment and they're doing very well, and then they will go to university, how would you feel, or how would the person feel if their medicine is stopped abruptly at that age?
Are we saying that someone like Ali, you don't develop ADHD later in life? She's always had it, and it was just never diagnosed. You don't get it. So anybody who's watching this morning who, kind of over 18, with these symptoms, you don't think you've just got it, you've probably had it all your life.
But it mightn't have been diagnosed, that's the thing.
You're absolutely right.
Yeah.
Most people have it, and they had the experiences that Ali was describing.
Yes. Can you cure it?
The treatments are very good. It's not a matter of cure, it's a matter of taking the symptoms away.
Yes.
And when the symptoms are away with time, for a lot of people it goes away on its own.
What are you going to do with Allie?
Treatment.
What sort of was that? Are we talking about drug treatment, medication, or behavioural therapy, or how do you do that?
The established treatments are medication, and for adults there are some people who can benefit for psychological treatments, but these are not widespread for adults. For children, they are.
Is it a step in the right direction to, once you've got the diagnosis, to accept and understand what you've got? Do you feel different now you know?
So. I do. I understand myself more, and I understand why I do certain things and the way that I do it. And yes, I think that is a big step in the right direction.
Probably a big step as well, people understanding you.
Yeah.
And what makes
you
tick.
It's quite right, yeah.
Yeah. What do you do now? Have you been able to harness the way ADHD makes you behave and turn it to good? For instance, you haven't been able to pin down jobs over the years and things, but have you been able to recognise, well, look, this makes me feel and behave like this, and I can actually put that to some good use?
Yes, I do, because with ADHD there are good points. We have the ability to hyperfocus. Hyperfocus. When we're interested in something, we can really focus on it and nothing will put us off. And I can channel that now. I can use my hyperfocus, which is really positive.
And you work in IT now, don't you?
I am an IT trainer.
So
but you're good at reading manuals.
I love reading manuals.
Oh, yes.
Nothing like taking a good manual to bed.
Yes. See, I do not have ADHD, I know that, because I can't read instructions on anything.
Well, and most ADHD, I think that's a bit different, isn't it? A lot of ADHDers can't. That's a bit different for me, is that I enjoy that.
And can it be hereditary in any? Because I know you've got a young son, haven't you?
It is, yeah. It's almost as heritable as the way height is heritable. So parents and children and their children may have ADHD is very well connected. Yeah.
And Doctor, what is it for anybody watching today saying, maybe this is in my family, maybe I've got it, maybe somebody I know has it. What is it? What causes it? And how does it materialise?
Nobody knows the exact cause, what makes it happen. Nobody, the science hasn't gone that far. There are some areas in the brain when people have scans that show that the brains of adults with ADHD are different from the brains of people who don't have ADHD. But what makes the change, it's not something that is known. People talk about cascade of events.
Yes.
So it is a bit in the genes, a bit in the environment, and it goes from there.
Okay. Well, good luck in your work. Good luck with what's ahead. You're quite excited by treatment and how it's going to develop in the future.
I am excited, especially with the nice guidelines coming out and recognising adult ADHD for the first time in September. And can I just mention the website for people as well, which is www.aadd.org.uk. So if you want to know any further information, and there's a forum on there, please contact.
Well, we can make that more simple.
We'll put details of your website on our website. Great. So if you do need any more information on ADHD, then contact our website, itv.com/The Morning. Thank you
both of you. Thank you very much indeed.
Can I just say hello to my 3-year-old son,
Of course
Barney?
you can.
Barney.
Barnaby.
Barnaby.
Hi, Barney. I'll be home soon.
There you go. Lovely. Still to come.